2 years into this pandemic, it's increasingly common to hear people talk about how we'll need to learn to live with COVID-19 in our midst. So what does that mean? Let's ask. In the nation's capital, Dr. Doug Manuel, senior scientist at the Ottawa Hospital Research Institute and ICES, and professor at the University of Ottawa's Faculty of Medicine. And Eleanor Fish, professor of immunology at the University of Toronto and infectious disease researcher with the University Health Network. Welcome to you both.
Great to be here.
I want to ask this question to both of you, but I'll start with you, Eleanor. How do you define endemicity?
Okay, so I think what we really need to do is get familiar with all the terms. So an epidemic is a disease that affects a large number of people within a community and is actively spreading so that the new cases of the disease actually substantially exceed what is expected. A pandemic is an epidemic that's spread over multiple countries or continents. Endemic is something that has a constant presence in a specific location. For example, malaria is endemic to Africa. You can get outbreaks when something is endemic, but endemic implies that there is a constant level. You know, we've got 4 coronaviruses that are existing and are seasonal, and perhaps SARS-CoV-2 is now going to be permanently our 5th coronavirus.
And Doug, I think when people hear endemic, we hear the word end, and I think we all just want this whole thing to be at the end of it. How would you describe endemicity?
Well, you know, one problem that I think we all have is that you know, it's Latin. Demo is people, and end is in. So it's in people. So that doesn't really mean too much, but I think that constant part. But you know what? I pulled up my last dictionary of epidemiology. This John Last is Canadian. He's in Ottawa, and he was the editor of Canadian Medical Association for years. And this is what's used worldwide. And I think that's the definition. Basically, there's the definition in the dictionary of epidemiology starts off with whether a disease or infection is present, you know, present, and then goes on to say or constant. So, so we don't often, transition from pandemic to endemic conditions. We don't talk about it a lot in our field. And, we don't have a lot of pandemics, so we don't often talk about when we're transitioning. But I think that's where the confusion is as well, because we usually think of endemic disease as present. Well, it's been present for 2 years. We've been trying to live with it for 2 years. And now, what is that going to look like in terms of it? Is it going to be constant? At what level? And I think that's the discussion that we're going to have today.
Well, this is, I don't have to tell you this, this is a once in 100-year event. And I think for a lot of us, it's something that's kind of just shocked our systems. We've all been through how many lockdowns. We just want, I think, an endpoint to understand that our lives might go back to kind of what they were before. Eleanor, keeping that in mind, has the definition of what endemicity is, has it changed over time?
Again, I think what Doug said is absolutely accurate. Endemic implies that it's constant. And, with SARS-CoV-2, it certainly has been a constant for 2 years, but we've had waves. And in addition to that, the severity of the disease and how we respond to it and how we live with it in terms of now with vaccination has affected our ability to accept its constant presence. So I think there's a tolerance level, a disease tolerance, and also a human tolerance that has to be brought into, that's weighed in. There's the economy that's affected by this. There's absolutely mental health, hospital capacity. We're reaching a stage now where I'd like to say we need to be disease tolerant. We need to accept that it is very likely to be endemic. I don't see SARS-CoV-2 going away. It's mutating. There's going to be a constant presence. There may be waves during different seasons. But what will we tolerate and accept so we can get on with our lives?
And Doug, is there a consensus in the scientific community of what that looks like?
At what level? No, I think part of the challenge is that there's quite a wide range. There's quite a few factors that are going to influence the level, and it's going to change over time. And so, things like variants, we know variants are going to come, but we're not sure if we're going to have variants, two types of variants, one that are going to be more transmissible than what we've got, and whether they're going to go back to the severity that we saw for Delta. That's all possible, but we don't know. So that's uncertainty. And then it's going to fluctuate. We can talk about the flu, but there's a seasonality to it, to Omicron. So we're going to have good summers, and the falls and winters aren't going to be great. UK SAGE says next fall and winter could be like this fall and winter. That's their kind of, I think they call it their most likely optimistic scenario. And it's going to change as we build up our community immunity. We haven't been exposed to this as a world or as a community, and so we're all kind of just being born into this. And we're going to develop community immunity through vaccination and boosters, or acquiring infections for those who aren't. As we acquire infections and get more immune over time, over years, that the waves and the pattern should become more consistent.
We've been hearing that phrase, we're going to have to learn how to live with this, from different people within the medical field and also from politicians. Our Chief Medical Officer, Dr. Kieran Moore, said we have to learn how to live with COVID. And our Premier also said the same thing. Some people are happy about that because it means we can go to normal. Other people are worried about what that means, because I think the past 2 years we've just lived in a way where we were all trying to not overwhelm the hospitals, and we were keeping our communities safe, people who are immunocompromised. So I wanted to get an idea from both of you. In your view, have we reached endemic state here in Ontario? Eleanor, I'll start with you.
That's a really tough question. So again, it's all about disease tolerance. So absolutely, we've got an incredible vaccination rate, and we're seeing that the number of hospitalizations and the number in the ICU is absolutely declining. We're seeing that I think in North America, they say about 46% of individuals have been infected. So we've got an immunity associated with vaccination, associated with infection, and certainly with Omicron, there's good evidence that it's a less severe disease. So is it endemic? I think it's constant. It's going to be here. I think we've seen in the last few weeks that we are disease tolerant. So we're absolutely inching towards endemic. I'd like to see the case numbers, which we have no idea in Ontario, really. So it's all about hospitalizations and ICU. I'd like to see those numbers come down even further and stay, either constant or come down more and more, so that, yes, it will be endemic. But again, there are other places in the world which are going to influence this. We haven't got vaccination all around the world. That's going to influence what appears on our doorsteps. We know that there's the potential for this virus to combine with other coronaviruses. There are many unknowns, but brief answer to your question, I would say that we're certainly inching towards endemic and disease tolerance, and that's what it's all about.
You brought up...
If you become disease tolerant, then we accept that, our economy, there are so many facets. It's not just the science. It's also, as I said, mental health. When you say we've got to get on and not have, certain restrictions or public health guidelines which limit appropriately movement and capacity and so on and so forth. There are so many factors to weigh into this that saying endemic, what does it actually mean? The question is, when do we move forward and say it's here to stay, this is the level, it's constant, and we have to open up our lives?
Eleanor, you brought up a few points that I want to come back to, but before I do that, Douglas, in your view, are we at the endemic state here in Ontario?
Well, we talked about sort of two criteria. Is it with us? And then is it constant? It's with us, absolutely. You could be really wishful thinking, a pandemic flu 100 years ago. It was around for 2 years, and then it turned into kind of a normal flu. And even SARS-1, if we remember back, it disappeared. And we don't really know. It may have evolved to a much more less virulent form, but we're not sure. So you could have really wishful thinking, but I don't think anyone is really going that far. So it's constant. It's with us, and it's a constant. For me, constant is tied to community immunity. It's more infectious than flu. It's more infectious than common cold. And you don't think of, for me, I don't think of like, I'm going to live my whole life and never have a cold or never have the flu. Well, we still have, the majority of people having not gotten COVID or Omicron. So until we start to see a pattern where people have been infected and we have had a series of boosters, I don't think we're going to see a regular pattern. So I think we still have a way to go before that regular part. When I've talked with reporters before, I said, we're in a peri-pandemic period. And I just make that up, kind of between the pandemic and the endemic.
I think that's going to take off. But Eleanor, you mentioned that, right now we don't know how many people are getting COVID. At the beginning of the pandemic, we were using that as a metric to gauge where we were with the stage of the pandemic. Are there specific thresholds that need to be met for us to get there in terms of hospitalization numbers or reproduction rate?
Again, it's difficult to say. So what made us accept that flu is endemic? It's seasonal. We accept a certain number of cases across Canada every year, and we accept, tragically, a certain number of deaths. So are we approaching that with SARS-CoV-2? Are we approaching a stage where we can say, yes, we know there are going to be X number of cases? I think that is a very serious discussion to be had. As I said, there are many things to weigh into the balance. What and I'm sure Doug will agree with me, what's really important is that in terms of not just hospital beds and ICU capacity, is that for us to accept COVID is a constant, we need to know that we have all the healthcare in place, whether people are hospitalized or not. We've now got Paxlovid, 2 tablets a day for 5 days, clears, accelerates viral clearance. We've got molnupiravir, which is not as effective. There are other drugs in the pipeline. So as we have more tools, in addition to vaccines, we have antivirals, as we hopefully train and have more healthcare workers, this is going to allow us, as I said, my phrase is not peri-pandemic, but disease tolerant.
And peri-pandemic kind of sounds like before the pandemic. So some people might be like, no, Doug, we don't want to go back there.
No.
But Doug, how soon do you think we'll reach endemicity?
Well, I think we're going to reach that constant sort of state. First severity or hospitalization. We don't, in public health and epidemiology, if we're really talking about endemicity, we don't really use that as a measure. You can have, really quite high, like malaria or HIV or tuberculosis. These are endemic conditions, but many people die of them every year. And then you can have, or you can have an unusual disease or rare disease, which is endemic as well. So I think, again, it's more that pattern. When are we going to establish that usual sort of pattern? When I talk with my evolutionary biologist friends or others, I hear around 5 years is the kind of most common answer. 2 years would be short, 10 years would be long. It could be longer than 10 years to get a regular pattern as we have, establish a sort of more constant level of community immunity and transmission patterns that will be seasonal. It's a respiratory infection. It will be more in the fall and the winter, and it will be with us every fall and winter.
10 years, really?
Yeah, it could be 10 years. I think 5 years is the sort of number I say, and it's going to get better. It's going to get better every year with curveballs. We've been surprised so many times, and we're going to have more surprises. There's going to be some good years and there's going to be bad years. The bad years will be more likely to happen in the next few years, and then less than in the further down. But 2 years would be short. That would be really optimistic to have an established pattern. in 5 years, I think, is a reasonable one to start aiming for.
I think a lot of people have been using the 1918 flu kind of as a guide of what might happen. And we've been hearing 2 years a lot. It's the first time I'm hearing 5 years or even 10 years. And Eleanor, we're seeing the province is loosening up some of the restrictions. Do you think that the province is moving towards an endemic mentality too fast?
Again, it's related to disease severity and the impact on people's lives. Are they moving too fast? Right now everything is trending down in terms of hospitalizations, positivity rate, ICU, projected or anticipated cases across the country. The concern is right now Omicron is 100%, it's here. That's the variant that is infecting everybody. There is the potential for there to be another variant that might cause a more severe disease. The likelihood of it becoming the dominant strain when you have Omicron is less. So highly transmissible, less severe disease becomes the dominant strain, even though you might have outbreaks and mutations of others. So I'm a little bit more optimistic that with a respiratory virus that is now not as infective in the lower lung as in the upper respiratory, we're probably inching towards endemicity a little bit faster than we might have hoped. And the test will be in the next few weeks, whether we can continue this downward trend as we start lifting restrictions. Because remember, it's still winter. If it was summer, I'd be much more optimistic because people would be outdoors. I hope so.
Well, Doug, we know that Canada has a good vaccination rate, but we also know some of the countries don't have access to vaccines. Is it possible for one country to reach endemicity while other countries are still in need of vaccines?
For sure. I think when we talk about endemicity or endemic disease, we usually think about specific populations. So, we don't have measles is uncommon now in Canada, but it's still more common in other countries, or TB or others. So for sure, there's going to be some areas where there's going to be higher rates of disease than others, and vaccination is going to be a big part of that. I think that I think the northern and southern hemispheres, that it's very seasonal. It's going to be very seasonal. So for us, the fall and the winter, we'll see more COVID in the coming years. Then in the summer, I'm really optimistic as well about the summer. Mm-hmm. Remember last summer and the summer before weren't too bad, and this summer is going to be better. So all the models are showing that later in the spring, like April and May, are looking good. The question is, if we open up too quickly, a lot of the success, we're doing great right now. The hospitalizations are coming down very quickly. But how much of that success is from the restrictions that we had throughout January? And there's clearly quite a bit of that from, quite a bit of success was from the restrictions. So as we lift restrictions, will cases go up, and how much? But then in all the models, really things are going to come down in later in the spring. So summer's going to be good. Summer's going to be good looking forward. At our institute, I was sort of saying, I think for our big meetings, I said, I don't know if I would plan them in January and February for next year or the next few years until we see what the pattern is. And I think that we need to recognize in the Northern Hemisphere that January and February, in the winter months, we always have had flu and RSV, and now we're going to have another one on top of that, and COVID. And let's live with our seasonality. I'm thinking more and more. Like, let's really plan on all that, really intense being with people throughout the year, except for January and February. We're going to need to be more open-minded about, large conventions or things like that. for the next few years.
And just to build on what Doug was saying, Eleanor, if COVID does just become something like the flu that we do expect seasonally, there are people within our communities who it might impact even more. Even right now, as the province opens up more, there are people who are immunocompromised who are a bit more nervous about what that means to their health. Who is most at risk of negative outcomes, even when COVID-19 does become endemic?
So certainly the immunocompromised and those whose immune systems are not as robust, the elderly. Right now we know there's compelling evidence that they are at higher risk of getting a more severe disease. And indeed, vaccinating the elderly is not as effective as vaccinating a younger adult. I mean, one of the issues here is we don't know if this virus or this endemic virus, hopefully soon, is going to evolve in such a way that it will be a childhood disease or an adult disease. So flu is more for adults, and another virus, which is called respiratory syncytial virus, is more targeted against children with who haven't been exposed. So there are a lot of factors to consider, but absolutely those who are at greater risk of more severe disease need to be aware of that and take the appropriate precautions to limit the kind of interactions they will have when there is spread in the community.
Doug, I'll give you the last 30 seconds.
Well, I agree. I think the analogies to the flu are good, but they only go so far. Omicron is twice as deadly for older people, and twice as transmissible for everyone. So that periodicity, seasonality will be similar, but and this is on top of the flu. We haven't lost the flu or RSV or other ones. This is on top of it. So our older people, our immunocompromised people. And then there are, let's not forget about long COVID. Like, again, the analogy to flu only goes so far because we don't have long flu, but COVID can affect multiple organ systems. And so we still are going to be learning about that and the people at risk for that. And then the younger folks, when you're born, you don't have COVID. You do have somewhat more severe disease than older, but maybe not as bad as some other respiratory infections that we have. But we don't have a vaccine for less than 5. So people who are born are going to be born into COVID. They won't have an infection, like they won't have immunity like other people who have been living with it for a number of years. And so how it's going to evolve for children is still of some concern or some consideration.
Doug and Eleanor, thank you for filling in the blanks on a really complex subject. And I know we'll probably have you back to talk about this further. Thank you so much for your insights. We appreciate it.
My pleasure.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.